Some healthcare facilities in the area say that they are seeing more cases of early onset dementia than ever before.
Some patients even being diagnosed in their 40s. CBS 2's Lisa Rozner has a story from Bergen County.
I think it was...
Whoa. Was it a turkey sandwich?
Chicken.
Rita Benezra Obeder, a former pediatrician, was diagnosed several years ago at the age of 59 with a rare form of dementia.
She doesn't remember what happened, minutes ago.
Husband Robert Obeder left his job 2 years ago to care for her. She attends Christian Healthcare Adult Day Services in Wyckoff and aides help at home at night. The couple has 3 adult children they raised in Ridgewood.
We'll have the same conversation with her every time they speak to her, in fact, several times. It's really a very sad progressive disease.
Dementia is an umbrella term for diseases characterized by a decline in memory, language, and other thinking skills needed to perform everyday activities. Alzheimer's is the most common. The National Institutes of Health says there's around 200,000 Americans in their 40s, 50s, and early 60s with early onset Alzheimer's. That's 5 to 10% of people with Alzheimer's. Administrators at Harmony Village, an assisted living facility in Paramus for people with dementia, say they're seeing an influx.
Last weekend, I met with a family whose brother was 45. We have a resident here who's 56. He has 3 teenage children at home and a wife.
Sometimes he doesn't remember his kids.
Correct.
Yeah.
Which is hard for the children.
Was always daddy's girl, and she can't come and visit dad. She finds it too emotionally draining.
The wife asked us to conceal her identity because coworkers and friends do not know.
The person is still there, but the person you married is not there anymore. And every time you visit and every week, he's losing another ability. So it's a mourning that never ends.
Geriatrician Dr. Manisha Parulakar says more awareness of the disease is spurring a rise in referrals, but there aren't enough studies to confirm an actual rise in cases. A recent conference explored whether processed foods were a contributor, but she says early onset can also be hereditary.
Is it treatable?
Most of our treatments that we have, they could help us slow down the progression. We cannot really cure anybody.
In terms of prevention, she says some studies point to the Mediterranean diet and exercises like crossword puzzles and Sudoku.
While no one can predict the future of their health, there are ways financially that families can prepare.
Husband-wife lawyers Yale and Lori Houtman say they're seeing more clients with this problem and recommend considering purchasing long-term care insurance starting at the age of 40.
It can pay for an aide to come into your home. It can pay for the cost of assisted living.
Everyone over the age of 18 needs a power of attorney, a health one, a healthcare power of attorney, and a financial one.
Meantime, as the disease progresses, the families say one thing that their spouses remember is how they made them feel.
So he proposed after I asked him.
She forced my hand. We've been married 43 and a half years.
A love they'll hold on to for as long as they can. In Wyckoff, New Jersey, Lisa Rozner, CBS 2 News.
And Harmony Village in Paramus has a free support group for loved ones of early onset patients. And we've got more information on that and symptoms of the disease at cbsnewyork.com.